Ato Wendu and myself have been neighbors for several years in the neighborhood of Bole Mikael apartment area. One day we had our neighborhood association, Uddur, and during the meeting, Ato Wendu raised his hand and he said, I would like to say something. And he started talking about his child who was affected with cancer, with blood cancer, leukemia. At that time, Matthias was at the Black Lion Hospital. And of course, he had already started chemotherapy. His hair was gone, and little crops of yellowish, brownish hair was growing on his head. He was a very gentle, lovely child, and we played together when he was there in his room. And then after that, I traveled to Toronto. And while I was there, my immediate supervisor's wife used to be an officer in Toronto, and then I asked her if she could help Matthias, and so she says yes, Sikis will support him to come and get treatment. And I was really overwhelmed with this, excited, and I was just about to communicate to Wendu. But in a few days' time, my wife calls me and she says, I'm very sorry to tell you that Matthias has gone. He's no more with us. That was the most heartbreaking experience for me. That's how I know about Matthias and Wendu.
After passing through that difficult time of, losing a child at that early, young age, the way they handled their grief and the way they turned their pain into, a purposeful life is truly remarkable. Even though Mati passed, their work, he is living through their work. So he has left, a huge and impactful legacy on this earth, more than, a person who has lived, all his life. Mati, in his short life, in his 5 years of, living on this earth, has left a noble legacy. And his family, the parents, their commitment and their passion to serve the other people or to help and reach out to others who are passing through the same pain as them is incredible, and they are impacting, thousands of lives through their commitment.
He started it in his own house. And it was kind of like a small, very small project that started in his living room, where he started to. The first very important thing he did was he tried to reach out and connect with stakeholders who are working on cancer at that time. And he came straight to the Ministry of Health. He started working with very few organizations that were active at that time on cancer.
Mr. Wendu, he faced a very severe tragic because of the loss of his child battling with leukemia, and he changed that challenge to action, and that creates a great opportunity for many to have an awareness on cancer, NCD, and also he delivered a lot of impact on his community.
I came to know Matheus Sondu Cancer Society 7 years back when I personally was involved in cancer treatment, and after I survived cancer, I had a keen interest to visit other patients who were facing similar hardships or who were passing through difficult situations the same as mine. So I wanted to support those patients, and I started looking for non-profit organizations in Ethiopia working on cancer. So I found Matheus Sondu Cancer Society when I was searching online. So I found their address there and contact number. I called and asked, and I personally went to visit the center. There I had the chance to visit the children who were sheltered at the psychosocial center. And then I was very much touched because I know how it felt to be in that position.
ጥቁር አንበሳ እንደመጣው ዲ7 ተኝቶ ነበር ለአንድ ወር ያህል። በዛ ነው ማቴዎስ ወንድን የሰማሁት። ያው ድርጅቱ ጥሩ እንደሆነ እዛ እንድገባ ብዙ ግፊት ያደርጉብኝ እንደውም ጓደኞቼ ናቸው። ህክምና ማግኘት ይከብድ ነበር ማለት 8 ወር እዚህ ተቀምጠሽ ወይ እንዴት ነው የምታሳክሚ? ይከብዳል። ቤት ተከራይተሽ ወይ ቤርጎ ይዘሽ ምናምን እነዛ ሲሆን ደግሞ በጣም ከባድ ነው። በተለይ ከክፍለ ሀገር ለሚመጡት ማለት ነው በጣም ከባድ ነው። ከገንዘብም አንፃር ብዙ ነገሮችን የመድኃኒት የምታወጪዋለሽ፣ የምርመራዎች ብዙ ምርመራዎች አድርገሽ ነው እንደገና ልጁ ህክምና የሚጀምረውና እንጃ የሚታከም አይመስለኝም ነበር በዚህ ሁኔታ ላይ ማለት ነው። በጣም ከባድ ነው።
500 ብር ለአልጋ ለሰው ሁለታችን አንዳንድ ሺህ ብር ከፍላለሁኝ ለምግብም ለምንም ብለን 2000 ብር በቀን እናወጣለን ማለት ነው። ከዛ ታሳክም ገንዘቤም አለቀ። እንደገና ዶክተሮቹ ቤተሰብ የለህም ወይ ምናምን ሲሉኝ እኔ ዘመድም የለኝ ገንዘቤም አለቀ፣ ይሄ ልጅ በቃ ሊያመልጠኝ ነው አልኩኝ። እንደገና ወደ ማቴዎስ ወንዱ ወደዚህ ላኩኝ ማለት ነው። ዶክተሮቹ ይዘው ይመጡ። እዚህ መጣሁኝ። እዚህ ስመጣ አልጋም ተሰጠኝ። ምግብም በቀን 4 ጊዜ ወደ 10 ሰዓት ላይ ወተት፣ አትክልት፣ ፍራፍሬዎች ይመገባል። እንደገና በገዛ መኪናቸው ይወስዱናል ያመጡናል። ተጥቁር አንበሳ በጤና መድናችን የሌለው መድኃኒት ዶክተሮቹ ተሯርጦ በደንብ አድርገው ያው መድኃኒት ተሯርጦ ያሳክሙናል። በጣም ደስ የሚል ድርጅት ነው።
ለድርጅቱ ለ8 ወር ያህል እዚህ ተቀመጠን። መገናኛ ያለው ድርጅትና 8 ወር ያህል እዛ ስንቀመጥ ምንም በቃ መድኃኒትም እየተገዛልን ነው። ህክምናም እንደገና መድኃኒቶቹን ምርመራ ያው ብዙ ምርመራዎችን ሲያደርግ ያገዙን ነው። ያንን በጣም በቃ እንደ ቤታችን ቁጭ ብለን የታከምነው።
The organization has supported especially children with cancer and gradually also started to focus on women also, cervical cancer and breast cancer women, and established a very close working relationship with Black Lion Hospital as well as the Ministry of Health. And together with these institutions, organizations, it expanded its services and provided support for cancer patient children coming to Black Lion Hospital.
Matheus Sondu Ethiopian Cancer Society has so many benefits for the cancer control program. Collaboration between his society and the Ministry of Health is very, very strong. It's one of a member for non-communicable disease advisory group and also for cancer program. It has really a meaningful support for the public health in terms of
capacity building in terms of supporting the awareness and also providing palliative care for the patient, and by bringing new projects and supports that's implemented in different parts of the country together with Federal Ministry of Health and the regional health bureaus. So his contribution is really a soundful, particularly by making a kind of support and push to have a meaningful policy level engagement at the national level for the better service and to support the preventive actions like tobacco control, alcohol advertisement, banning, and other engagement. Recently, we have also some activity working together on Unhealthy Diet Control Act.
The Ministry of Health recognizes Matthew Sondu Society, Matthew Sondu Foundation right now as a very strong collaborator, very strong partner with a very clear vision, and also the ministry recognizes him as a very key contributor to the national agenda on NCDs and cancer. So he is considered as one of the most important stakeholders who have shaped the country's cancer control landscape and NCDs in general. So whenever you talk about any strategic directions in a cancer landscape, Matthew Sondu's foundation is the one that always comes up front in terms of influencing policy practice in Ethiopia on cancer.
Matthew Sondu is working on a range of issues, starting from pediatric cancer. It works on women cancer like breast cervical cancer, and also now we are working on broader NCDs, particularly after 2020, changing our strategic plan on more broader issues like NCD. We are working on DM, hypertension, and also we are working on major risk factor like tobacco, alcohol, and we have brought very important policy change and as well as also public and community level awareness on this major risk factor.
Some things that usually in the healthcare system we don't consider, we don't factor into the cost of cancer care. We usually talk about medicine, but we don't really appreciate the indirect costs that families are facing. Transport cost, lodging cost. These are the costs that usually the families bear the burden, but usually the system doesn't cover that one. So he tried to fill those gaps in terms of total cancer care.
And through that support, the children and their parents who come from rural areas are supported with transport expenses. They are given accommodation here to eat and, and stay. And also transport from the center to Black Lion Hospital when they have to follow up their chemotherapy and other treatments. Occasionally, when the hospital cannot afford to provide some treatment or laboratory examinations, the association provides the funds to carry out laboratory tests.
The psychosocial center is not only a center, it's like home for them, where they share their experience and their fears or the lessons and everything. So they feel like a family, and it's a big not only economic support but also this emotional and social support that they find there. So that's a huge support for the community, especially for the vulnerable ones, who come traveling a long way to get this treatments in Addis Ababa.
ሰናን ስፖርት ድርጅቱ ይከፍላል። ስንሄድና ስንመጣ ሪሲት ያው ካን ቲኬት ምናምን ያው እንትን ብለን እናመጣለን፣ በሪሲት እንመጣለን። ያን ሂሳብ አወራርደው እንሄዳለን፣ እንመጣለን። ስንመጣ አልጋም እናገኛለን፣ ፍራሽን ምግብም ደግሞ ቅድሚያ ደውለን ንገሩን ይሉናል። ከዛ ቅድሚያ ሲነግሩን ስንነግራቸው ምግብ ተዘጋጅቶልን ይጠብቁናል ማለት ነው። እንደውም ቡና ቀን በ7 ሰዓት በ6 ሰዓት ቡና ይፈላል። ያው እናፈላለን። ቡና ይሰጡናል፣ ሱካሩንም ይሰጡናል። በጣም እናትና አባት የሆነ ድርጅት ነው።
አቶ ወንዱ ልክ እንደ ቤተሰብ ልክ እንደ አባትም በቃ አይዟችሁ ነው። ያው እኛን አቅርበውን ነው ልክ እንደ ቤተሰብ ነው እንጂ እንደ ውጭ ሰው አይደለም።
አረና አቶ ወንዱ በጣም ልጆቻችንን ሲመጡ አቅፈው ስመው ሁሉን ነገር በቃ አዝነው አስበው አብሽሩ አንዱ አስደስቷቸው ደግሞ ቁርስ በየሰዓቱ መግቧቸው፣ ስለ አትክልት ነገሮችን መግቧቸው፣ አብሽሩ ይድኑላችኋል፣ በሽተኛም አትበሉ፣ ህመምተኛ በሉ፣ በሽተኛ የሚል ሰው አወድም እና ህመምተኛ በሉ የሚል ነው። በቃ ሆነ ያዝናኑናል ሲመጡ ማለት ነው። በየጊዜው ይመጣሉ። በዓል ደግሞ ሲሆን ጥቁር አንበሳ ሄደን እዚህ ይገዙናል። ለክርስቲያንም ለሰላምም እዚህ ይዘጋጅልናል። እዛ ደግሞ ጥቁር አንበሳ ስንሄድ ደግሞ ያው የሁሉም ለክርስቲያኑም ለሙስሊሙም ለቤንጤውም ለሁሉም የሚስማማ ምግብ እዛ ለተኛው እነዛ ጋር ሚስቶቻቸውን ልጆቻቸው ትተው የዚህ ያለ ሰራተኛ በሙሉ እኛ ጋር ነው የሚያከብሩት።
ብዙ ሰው እየተጠቀመ ነው ያለው እኛም ሳይቀር ማለት ነው። አሁን ትንሽ ጭንቅላቱ ላይ እንትን ሲያመጣ ራሱ ኤምአርአይ ሲቲ ስካን ምናምን ብዙ ምርመራዎችን ከውጪ ነው ስናደርግ የነበረው እና ያን እየተረዳ ነው።
Now we are running like 10 projects, and these projects are working on a range of conditions like cancer, NCD, and also major risk factor. And these projects are supported by different international partners, and most of them are US-based partners like the Gates Foundation through SCBF, Campaign Tobacco Free Kids, it's again US-based organization, and also Global Health Advocacy Incubator, again US-based organization, and also we have a Bloomberg grants through Vital Strategies. So we are working on a range of public health programs.
Just to mention some, Mukaturi in Oromia region and Addis Zaman hospitals in Amhara region, where Matthios Wendu is currently, working on health system strengthening programs, so renovation and other capacity building programs. All these are an impactful works that Matthios Wendu is doing. In addition, in its advocacy and awareness works, the Matthios Wendu works with the local governmental and non-governmental institutions on policy matters and other rules, regulations, and governmental laws that affect the outcome of this NCDs and for the improvement and the prevention of this NCDs in the countries.
Ato Wendu is a very highly committed person, very dedicated. Right from the very start, he was expending his own resources, his own money, his own time. Not only himself, but the entire family was involved in whatever he was doing. He has wonderful vision, not only for Ethiopia, but something that would go even beyond the border of Ethiopia. He is now, and his organization are thinking of establishing in the long run Healthy Africa Center, where they will have a proper hospital for cancer treatment and research here in Ethiopia, a center of excellence regarding cancer in Ethiopia. And I have been discussing and involved with him in these issues, and we hope and pray that the government also will support this initiative, particularly by providing land for the development of this wonderful initiative, so that people who are now obliged to travel abroad for cancer treatment, they can get treatment right here in Ethiopia. And maybe other neighboring countries' patients could come and access this treatment and facilities here in Ethiopia. So this is one of the visions that the organization has, and Ato Wandu is highly committed and dedicated to see this vision realized in the future.
Yeah, Ato Wandu is my immediate supervisor, and I know him for the last almost 10 years. He's very committed person. I think everybody agree with that. And also he has a very strong leadership when it comes to health, not at his community level, but also at the global level on many different stages, like on different conferences. And also he received different recognition for his effort.
አሁን ይሄ ቤት ኪራይ የዚህን የቤት ኪራይ ለኛ ቢደረግ ለኛ ለብስ አልባሳት ቢደረግ ለድሃ ቢደረግ ጥሩ ነበር። ግን እኔ በጣም መንግስቱን ታዝቤዋለሁ። ይሄ ቦታም ቢሰጧቸው የሆነ ቅርንጫፍ በሆነ ቦታ ቢሰጧቸው የዚህን ኪራይ እዛ ቤት ቢሰራበት በጣም ደስ የሚል ነገር ነው እና አሁን ይሄ የኢትዮጵያ እናትና አባት የሆነ ድርጅት ነው።
ለአቶ ወንዱ እንግዲህ እግዚአብሔር እድሜና ጤና ይስጣቸው። በጣም ረጅም እድሜና ጤና ይስጥልና ማለት ቃምን ከዚህ የተሻለ ደግሞ ከዚህ የተሻለ ብዙዎችን ሰብስበው እንትን የሚረዱበት ነው እንግዲህ የሚመኘው። ትልቅ ድርጅቱም ተቋቁሞ እንግዲህ ቤት መስሪያም ተሰጥቷቸው ቦታውን እንግዲህ እንትን ብለን አይተን ጥሩ ነገር ነው የምመኘው እንግዲህ ያለኝ ነገር።
ኧረ በጣም እነሱን እንደው ያቆይልን፣ ለኛ ሲል ያቆይልን፣ እድሜያቸውም እንደው እድሜያቸው ይርዘምልን፣ ቢያጥርም ፈጣሪ ያስረዝምላቸው ብዬ ነው የምወስነው። እስተልጆቻቸው ክፉም ማያገኛቸው መህመምም ማያገኛቸው እንኳን ያለ በእነሱ ያለ ሰራተኛም በእነሱ ደሞዝተኛም ሆኖ አፈላልጎ ምንም ብሎ በሚሰራው ሹፌሩም ተደሞ ተዝሁ ነው፣ ዘበኛውም ከዝሁ ነው፣ አብሳውም ከዝሁ ነው። አንዱ አብሳይ ስንት ቤተሰብ እንደሚያስተዳድር ነው፣ አንዱ ዶክተር ስንት ቤተሰብ የሚያስተዳድር ያ በዛ ስም ሆኖ ስንት ነገሮች እየተፈወሰ ነው ያለው ሰው ማለት ነውና እነሱ በጣም እድሜያቸውን ያስረዝምልን ብዬ ነው የምለው። በቃ
I really wish to very success for his legacy, because he has a really meaningful works he do with together with the Ministry of Health and other stakeholders and at the community level as well, and his service is really supporting many Ethiopians, and as well as that in lines with the ministry vision, and also starting from prevention, early screening, providing a good treatment service, and also up to the palliative care. It's all important for the patient. So he's with his passion and committed stand to fulfill particularly the last mile of the service in general. So he has already established a strong legacy, and I really wish all success even for the future.
My wish and hope for the organization is that it continues growing and reach even more people across Ethiopia and Africa. And I hope it intensifies its fight against cancer and NCDs in general, and it plays a leading role in building a healthier society. And I hope it succeeds in establishing the Healthy Africa Project Center. I know that the organization has already laid a strong foundation, and now it's time to scale up even more and impact millions of lives.
Well, I wish for Ato Wandu a very long, healthy life, so that he will see all these visions and ideas that he has to become a reality, and for the Matthias Wandu Cancer Society to develop and achieve this healthy Africa vision realized.
Yeah, I wish for this organization to keep its momentum and to bring an impact on NCD and on broader health issues. And personally, specifically for also Mr. Wandu, who is currently battling with cancer, I wish him for a long cancer-free life and to continue his impact on his community.
በረካ ሁኑ እናንተም ይረዳችሁ አላህ ይርዳችሁ አላህ ይጨምርላችሁ ወደፊትም ያለውን አቂባቸውን አላህ ያሳምርላችሁ። አቶ ወንዱንም እድሜያቸውን አላህ ያስረዝምልን። ከናንተም ደግሞ ተመራችሁ እናንተም ደግሞ ሌላም ድርጅትን የምትረዱ የምትጠቅሙ ተባታች ያላችሁ የምትረዱ የምትጠቅሙ